This episode is brought to you by Halfway Toyota, Ratel Online Outdoor Apparel, and Vortex Optics.
Okay, welcome everybody. This is going to be quite an exciting episode. I have a very good friend of mine, Martin Millar from Hawick, and Martin is a first aid guru. He's a paramedic amongst what are your titles again? You do
health and safety.
Health and safety training, first responder.
Correct.
So Martin is an absolute guru with regards to medical stuff, and I thought I'd make a little short video to share with a lot of our viewers about, we've got a big upcoming trip. We are going to be doing an overland tour, very exciting trip to Botswana and Zimbabwe, which is just myself and the two kids. And what I find is quite important and quite different, and why I want to show you this is obviously we want to prepare for a bit of medical potential emergencies, things that are possibly priorities. You know, obviously me traveling on my own as one adult with two children, you kind of want to have the right stuff on board to deal with certain situations. Obviously we can't travel with a hospital, but you want to have the basics in place. So what I've done is I've traveled a lot through Africa, and I do safaris for a living, and I've kind of got a pretty good idea of what we use and what we take. But under the circumstance of traveling with children, I think it's quite important to have Martin's opinion on what are important and relevant items to include in your first aid boxes that go in the vehicle. So what I've done is I called up Martin. I asked him to pop around to the house so we can have a little chat about it, and I want to be able to share this on camera with everybody to give some people ideas. Doesn't mean you have to do what we're saying. This just might open up a different train of thought about being responsible, traveling responsibly when overlanding and going into the bush, either as adults, but more especially with children. So what I did is I carry two first aid boxes. Normally one stays permanently in the vehicle. It's a nice little hard box that stays under the driver's seat with quite a good variety of items in there. And that stays in the vehicle permanently. I have a go-to bag that I made up myself inside. Obviously you can purchase pre-organized, pre-arranged medical bags for different purposes, different reasons, for different space capacities. Whether you're hiking, traveling by vehicle, or whatever the case may be, or home-based or lodge-based equipment and items. So this is my then pick up and go bag that I normally then throw into the vehicle on a trip, as well as this. One more item that we're going to touch on is this, which is a bag valve mask, and this stays in the vehicle permanently, but we'll go back to that shortly. So what I did is I pulled out these boxes, which are my first aid boxes at home, that I keep at the house, with a variety of stuff from bandages to gauzes, gauges, etc. inside here, to the bottles of medication, tablets, gels, creams that stay in that box, and basic tablets in this box here. And then some more sort of go-to plasters and bandages, etc. inside here. So, and then obviously things like scissors and nail clippers and knives and blades and all of that stuff as well. So that stuff stays at home. So what I've asked Martin to do is come here today, have a look at what I keep in the vehicle, what I keep in this bag, seeing what else is here, and saying, right, that's cool. With regards to kids, maybe that's not so important. Let's maybe add that in. So Martin, thank you very much for popping around here today.
Pleasure.
Always trying to seek great advice, and Martin's definitely one of those persons that you can rely on to give you good advice. And Martin, we've actually done first aid courses through Martin. I've done level 1 and I think 2. It's just highly advisable to go and do those sort of things prior to a trip. And what we're actually going to do, and I'll probably show it in a later episode, is I'm going to ask Martin to actually spend an hour or two with the children, not do an official course, but give them some heads up on just exposure to how to deal with different situations, how to apply a bandage properly, how to deal with breakages, splints and all that stuff. So yeah, just a little bit of basic knowledge for the kids at their age that they can soak in a fun way, but that they've got, it's not all new to them should an incident arise. But Martin, thank you. So let's go through a few things here. I've shown Martin what's in this box here, which stays in the vehicle. I've shown Martin what stays in this box, in this bag here. If I look in here, I have a little syringe. I've got some eye drops in here, those little disposable single-use eye drops. I've got some bandage, some gauze in here. At the bottom, I've got a lot of plasters, some cleaning swabs, some alcohol swabs, safety pins, and then some tweezers, and most importantly, a little needle, because I find the needle is super useful for, we are always getting splinters. The kids are running around with no shoes on, or getting a branch, cutting firewood or whatever, and get these little splinters. So a couple of decent gauge needles for getting splinters out. So that's kind of what we got in here with our scissors as well. We can now go through the side of the bag. So that's in there. In the second bag that Martin's going to go through, we're going to just throw those in there. Those are little tweezers. My second
Excellent idea to have a decent pair of tweezers. The plastic tweezers you find in these kits are not suitable. So make sure you get yourself a decent pair of tweezers.
Yeah, you get lots of good and bad, and these ones are quite nice in that they've got quite a sharp point to them. So they're really getting down. Some of them have got a big flat edge on them,
Yeah.
and you can't really get hold of what you need to, and they slip off. So these are actually even little, slightly almost serrated on the inside to give a bit of traction there. So that is a really nice little pair of tweezers to use. Then the second bag that we have here, that I have, at least, the way I've prepped it, and I think that's what I'll do, is I'll go through and show you what we've got, and then Martin will say, well, to this, let's add. But I keep a little box in here. I don't want to keep the cardboard boxes of all the tablets together, purely from the fact that it's quite bulky. I know the instructions are in those, in the dosages, but I think get familiar with them, with the ones that you like to use, and know what you're going to hand out. So in this little hard case here, I have a variety of go-to sort of tablets. We've got Norflex, Pain, Gen Pain as well. I do keep a sleeping tablet. That's normally for my travels, flying. If we really need to get a good night's sleep or forcing a sleep. Some more Gen Pains. Allergex, kind of always my go-to for allergies. This is the non-drowsy version of Allergex. Obviously, there's a few other options to take there as well. Gaviscon, Calpol tablets. So I think Calpol is quite a useful one for kids.
For children.
So obviously Calpol we get in two forms. We get in the tablet form and the liquid form. But I think that's probably quite an important one to take. For pain and fever and the youngsters, Calpol is kind of a go-to. I know at home it is for me, but maybe I need to add some more Calpol into this little box here. Gaviscon and some more bandages on the bottom here. Cataflam, that's also quite a useful little tab.
Very good for
inflammation, yeah. So that's what we've got in this little box here. So automatically, I know there's a couple of things I'm going to add in there. The other one that I was actually talking to Martin about that I think is a go-to tablet for me. It is a prescription tablet. It is an antihistamine. It's a cortisone-based antihistamine. Is celestamine.
Yes, very good, because children can take it.
Celestamine for children can take it, but when you get down to spider bites and scorpion stings and all of that, it's kind of an upgrade on an Allergex because of cortisone in there. So celestamine, absolute go-to, but it is prescription, so you're going to have to go to your doctor for celestamine and get yourself some of that. In the same box,
Ophthalmic.
Ophthalmic ointment. Although I have eye drops in there, if you really got an eye infection and you need to get it sorted out while you're out in the bush, good to have a little tube of ophthalmic cream here, ointment to apply to the eye. It doesn't take up any space, but when you're out there, an eye issue can become a serious issue. I've had it on safaris before that we needed to get stuff in. So absolute must. I keep this is Astivent. I'm not really asthmatic, but sometimes go into a bit of a what's the phrase for
Short of breath.
Short of breath, like a bronchial, so you're almost like a bronchial dilator that you need
Almost
as well.
like an asthma attack.
Yeah. I've got another one here that I keep at home, Van Air. These are all prescription, but it is quite advisable to just have one in the vehicle. And it might not be you, it might not be your situation. You can be helping somebody else out
Correct.
in a situation in camp or whatever the case may be. So on that note, I think it is important to remind everybody that you're not really there to, we're not legally bound to assist other people on drugs and give them stuff that has to be their own consent. But, with regards to this situation, I'm looking after my 2 children. I'm in full permission to administer medication to my children. But to administer to other people is a no-no without their consent.
Correct. So what you would do is you would advise the tourist that this is what you've got, what would they like, and offer it to them. If they take it, that's up to them. If they don't, it's not your fault. So don't make it your fault. This medication is purely advisory, and it will assist you to getting to the point where you get to the doctor or the hospital.
And it's sorting out your situation, but you're making it available to others if necessary.
Correct.
Okay. And then in here I also have a whole bunch of smecters. In the powder form, you get the little sachets, the premix smecters, the on-the-go smecters, which is for diarrhea and stomach issues. For me personally, it's kind of like a wonder muti. We use it at home and traveling all the time, whether we by road, by airplane, going out to different destinations. Nothing worse than having stomach issues. So smecter is a go-to for me, and I keep a lot of it. You mix these powdered ones in water. They get flavored ones because the standard one is not so great. But mix it with water, and you end up with a bit of a strawberry flavor and a couple of other odds and ends. So this little bag is containing my basic tablets and medications in there. And then if we scroll across to the next bag here, I have a few of my creams, etc. Antizan is a really good cream for allergic, for stings, for rashes, etc. And general skin reactions. So Antizan, I think South Africans are very popular with this or familiar with this. I have Savlon. This is obviously very important. I think to have a good full container of Savlon, which is an antiseptic cream for most circumstances, to be able to clean up, before applying bandages, plasters, dealing with cuts, wounds, bites, etc., etc. So Savlon is important. Obviously, we've got the liquid version, which is nice for volume. And Martin was mentioning to me earlier that if you do end up getting a bit of a rash to the antiseptic, you can sort of dilute it down with a bit of water as well, and apply like that.
Please just always ask your clients if they, or your family, you will obviously know your family, but your clients, if you're a professional ranger and you're taking people with you, just check their allergies before you leave so that you can try and counter that before you leave, rather than get out into the bush in Botswana and find that you don't have the correct stuff. So just check on allergies before you leave.
Yeah, and ask the question as well at the time.
Yes.
If they're compass mentors.
Correct.
Inside here also Blistex. Obviously good lip balms will work well, but Blistex, if you end up with, I've got a cold sore at the moment just from a lot going on, but Blistex cream to apply to the lips, especially in winter, you end up with really dry, cracked lips, and there's nothing worse than getting onto a tour or a trip and having these dry, cracked lips that you can't smile and talk. So Blistex and some good lip creams, lip ices, and obviously also good for the sun. I think one has to be responsible these days with the sun, and quite a few of them have got a bit of a UV resistant in their creams. So Blistex, good, and going with the smecters that we used earlier, Gastropect, also really good to have because there's nothing worse. I think one of the biggest things when you're overlanding and traveling is the possibility of bad water, which can cause stomach issues. One of many things that can cause stomach issues, but dealing with that in the bush on tour is not great. So between smecta and gastropect, I think you can sort out most circumstances there. And then a favorite of mine from childhood days, and the smell takes me back to childhood days, is calamine lotion. So we did have antizan in here, but calamine lotion also applied for rashes and skin reactions, etc. Really, really nice to have. So keep the calamine lotion in there as well. There I've just got another insect repellent there. So that's those three. We're going to finish this, and then I'm going to ask Martin to go back through and think of things that we need to add and subtract from here. The next bag here, we've got some gloves. The next two bags effectively are dealing with bandages. We do have a little mouthpiece here in an absolute emergency if we need it. And a variety of bandages, some gloves, tampons for dealing with bullet wounds, etc. If you get into that unfortunate situation. Some more burn gels, steri strips. These are closure strips, which are quite useful for closing wounds. An interesting one, waterproof bandages, plasters of various sizes, waterproof ones if possible, because most of the time you're going to be outdoors and exposed to the elements. But get different sizes, because obviously if you've got a little scratch, you don't want to have to apply this monster plaster to that and waste this plaster. So get plasters of various sizes. I've got more insect repellents in here. And then I think quite important, and I know Martin will touch on it again, I'm sure, but burn shield. And you might think, well, why do we need burn shield? Well, if you think about it, you're out there camping all the time. We're dealing with either gas appliances, cooking, pots and pans, etc., and gas burners, as well as fireplaces. I mean, effectively, you're spending every night out around a campfire. Exposed flame and logs and things like that. And Connor's done it where he's leant up against the cast iron pot and burnt his back and that. So absolutely keep a couple of things of burn shield. You get the big packages like this and the smaller ones as well. So get a couple of big and small, so you don't waste it all if it's a small burn by opening a big packet. And then that's the rest of that one. And then the other one is following on from the first, with a variety of bandages, different widths, different sizes, cotton wool, compression bandages, various dressings. What do we have in the back here? Waterproof dressings, and an emergency blanket. I think every first aid kit has an emergency blanket just for applying in a variety of situations. So that is, in a nutshell, my go-to bag, which we might change now after this discussion. And then in the go-to box in the vehicle, very quickly, a very similar setup to here, probably on a more micro scale. A nice big compression bandage with its own Velcro.
Just a tip on your compression bandage: if you don't have a compression bandage as such, the ideal thing is to put the bandage on and then you tie the knot over the actual wound site. That will give you compression. You can add another rolled up bandage or some extra gauze underneath that knot, tie it. That will give you continuous compression. But always check the nail beds first for blood flow. If your fingernails are pink, when you start, you squeeze that nail bed for 4 seconds, release it, it's white, it becomes pink again within 2 seconds. That will tell you that you apply that bandage correctly. If it's longer than 2 seconds, just release the pressure a bit and then reapply it to make sure that you don't cut the flow of blood off.
No, you're creating another problem by cutting all the blood flow off to a limb or something.
Before you get to the hospital, you've got blue fingers.
I remember we've done Johan Marais' first aid snakebite training and awareness courses over the years. And I know that they supply, it's probably a basic medical one as well, but they supply a compression bandage that when you stretch it, there's actual squares printed on they're sort of rectangular to a point. And then when you start applying and you stretch it, when it becomes a square, that's that's got to the right stretch. Obviously, it depends on the appendage that you're applying it to and how far it's going to go around. But once it's going to that square, it's kind of giving you a good indication of the tightness of that compression bandage once it's created that square. So, they use that from a sort of semi-tourniquet perspective on snake bites, applying to the bit area, wrapping up that entire limb with those pressure bandages. So that's an alternative to the standard pressure bandage. What is useful, this little box is hard case I've had forever, but inside here on the lid it's got a peel back here and basic information, go-to information, really basic, but sometimes it's useful to applications and dealing with certain scenarios, from breakages to burns to bites to cuts, etc. So a little bit of extra information always goes down well, because sometimes we all rely on Google these days on our phones, but sometimes when you're in the bush you don't have signal. So a little bit of hands-on information is actually quite useful. And I think in the bottom of this box, I've actually got another little dusty booklet which takes you through all of those. It's a first aid instruction manual by due south, dealing with basic life support algorithms, choking, wounds and bleeding, general hazards, burns and scalds, broken bones and injuries, and hypothermia. So this is a really useful little go-to book if you're just in doubt of how to deal with the situation. Because don't forget, it's you doing what you can while you're there for yourself or your children. So a little bit of extra information to do it right the first time if possible will go a long, long way. And this will talk about doing splints and all of that. We've got some cool little ideas with regards to that from a bush mechanic perspective that we'll touch on just now. So that's really useful to have, a little bit of extra information. You don't need an encyclopedia. You don't have time to read that in an emergency. So in here, I've got a variety of things from little suppositories for the children. This is a Valoid suppository. Always works well on the kids. Some more cold sore cream. Sounds like I get cold sores often. Little syringes, needles, another antiseptic. Betadine cream, really, really good. Brilliant. For most things. Betadine is a really, really nice cream to use. Antacids, that's just basic stuff. A variety of swabs. Also quite important, that wasn't in the other one, is keep some of these sachets of rehydrate. I think dehydration is not enough attention has been paid to being out in the bush and people getting dehydrated. In various circumstances, hot days out there, especially kids, don't drink enough water. So keep a couple of these rehydrates, throw them into their water, into a cup, get the electrolytes and everything back up, and that's actually quite a useful thing. They don't take up much space, but very useful to get.
They
that.
come in a couple of different flavors as well, so very nice to choose. Get the children to choose their most favorite one. Yeah,
and there's no harm in every now and then just having one. Just get the system going again a bit. Keep a variety of eye drops here. These little disposable ones. Twist the cap off, use it, throw it away. Dust, sticks, stones, flies, nunus, you name it. Everything ends up in the globe. So those are always useful to have. Another little pair of scissors, a little bit of tape. In my hand, I have got some. This is quite useful. This is Dermabond, helping with cuts. Kind of a bit of a glue on your skin, like a super glue, putting a cut together and applying it to keep it closed. So that, in an emergency, that comes out quite useful.
But just for the go-to guys, that is a medically approved Dermabond, not to fix your shoes.
Bactroban, again, effectively like the betadine. Some more antiseptic Savlon. Another blanket. Got a little blade to cut if we need to cut. And then in this bag, some more little gloves, some more waterproof, really nice plasters, big plasters for covering big wounds. In this bag here, again, like I did in the other box, keeping your sort of go-to tablets all together. I've got some pain blocks, I've got Allergex, Gaviscon, burn shields, and Nurofen inside there, another set of tweezers. And then in this bag here, a variety of plasters of different sizes, a little stitching kit here to apply if you want to do your own apply stitches, close up of injury or a wound, and some iodine and bandage straps here. So some more cooling gel, burn shield type gel, gloves, big bandages there. So kind of a variety, but they're all in this little Ziploc, which is quite nice. It kind of does a micro version of that bag, in that you take this out and use it, take that out, use it. It's not all just a mess of things. There's a bit of a mess in here, but for most parts, it's good. It's good. So these are practically used things. I mean, the thing is, with a lot of these videos and these setups, it's like best case scenario. But I tell you what, out there sometimes not the best case scenario with where you're storing, where you're putting things. So these are the two things that I keep in the vehicle all the time. We're going to probably add or subtract from there a little bit. But the one last thing that I want to touch on here is probably one of the most important items in the vehicle. It comes in a nice hard case here, and this is what we call a BVM. And I remember I got put onto this with Johan Maria with the snake bite courses. The reality of being in a vehicle and doing CPR on somebody for an extended period of time, or while you're moving or you're off-road, is very, very difficult. And dealing with snake bites in particular, where you might have respiratory failure according to a lot of the venoms, you can actually keep that person going as long as you can keep them breathing. So a bag valve mask takes a lot of the physical pressure away and tiredness of applying CPR correctly. So a bag valve mask effectively takes over. You apply it over the mouth. So if I open it up, it's going to pop out. And this applies over the mouth and the nose. You're going to obviously make sure there's a good seal there. And then there's a bag here that you're squeezing however many seconds.
One compression every 5 seconds for adults and one every 3 seconds for children.
So one every 3 seconds for children and one every 5 seconds for adults. And you can do that. Somebody can be sitting as a passenger and just doing that.
And the nice thing about this particular bag valve mask is children can use it. It's very easy, and they feel very important when they know that they're keeping somebody alive. Make sure your children know how to use this. So you've got this little bag that pops out. You've got the BVM that pops out here like this. This goes over the mouth and nose at the same time. And then they're literally squeezing this. And this is ideal if you have a little oxygen bottle. You can pump oxygen in here, which will then give the patient 100% oxygen as opposed to only 17% breathing through the atmosphere. So if you have a little oxygen bottle, brilliant to just supplement the oxygen going into the patient. If they're getting 100% oxygen, they can be breathing 1 time a minute. They're getting 100%. If they're breathing normally at 20 breaths a minute, they're only getting 13% oxygen out of this. 4 times 13, you're looking at about 52% oxygen for a whole minute, as opposed to 100% oxygen through here.
So this just gives you both options. Like if you have it on tap, you can plug in. If you don't, you use the bag and apply that.
Correct.
Apply that oxygen. So every 3rd second for a child, every 5th second for an adult.
Yeah.
Very easy to apply. Very convenient little bag and box. Just push it in there, close it up, twist it closed, boom, and throw it in behind the seat or under the chair.
Now we look at Clive's ready to go kit, and this has seen a couple of years, so I think it's ready for retirement. Clive, we're going to give you a brand new one.
Oh wow.
Which has pretty much, it's got a couple of splints. I really detest these splints because they are actually pretty useless. They are very, very weak. And if you get these things early in the morning and you bend them, they snap. So I tend to warm these things up. I fold them around, I add them into here. You can actually add these two together. So you just pop them in together like that, and they make a long splint. They will work for children. But on big adults like Clive and myself, then they're not going to be that handy.
So obviously it's an alternative in the bush.
It's an alternative in the bush. In the bush, if you don't have these things, or you don't have any splints at all, use twigs, branches of trees. Nice thick branch for the legs. You take a bandage, you roll around the stick so the stick's not actually hurting the patient, and then you bandage the splint to the patient.
What's really useful is actually if you get a thorn tree, like one of the acacias with thorns on the limb, like nice hook rods, you can actually hit it hard, pull it in, and they all hold in place, and then you can wrap it up. Eh?
Yes. A decent pair of scissors, essential. One rounded point, you're not, even if I take this and try and stab myself, I'm not going to hurt myself, but I will with that one. However, that one is counteracted by the fact that you've got this, which you can now stick under tight clothing, and you can push it against the skin. It's not going to cut the patient. Essential.
That's pretty important, because I know those little scissors of mine, I'd probably cause more injury to somebody than what we were trying to deal with.
Correct. We've got some absorbent gauze swabs, which are just your cleaning up swabs, and then you've got your sterile swabs, which actually go over the wound. We don't ever use cotton wool, which is not in this kit. You don't use cotton wool on wounds anymore because it tends to stick to the wound, creating a bit of infection. We have also got the emergency rescue sheet, which is commonly known as my space blanket. This retains body heat, so don't just put it over the person. Wrap it around them so that you're making a little oven, retaining that body heat. You've got a normal conforming bandage, and we've got some triangular bandages which have a myriad of uses. You can use it as a normal bandage, or you can use it as a sling to put a broken arm in, or to stabilize a broken collarbone.
Well, that's very special. Thanks, Martin. So I think one of the main parts of this video is to actually discuss traveling with children, because that's kind of in essence what we're doing. Safari family, we're on the road a lot, deal with my situations as an adult, but there's probably a host of situations that happen quite a lot with children and that they expose themselves to in their little bit sort of more carefree way of doing things out in the bush, and not worrying about circumstances and resulting situations that can happen. So kids are quite conducive to scratches and abrasions and cuts and sores and burns and stings. So there's a variety of maybe other medications that I just pulled out here that is worth considering adding into your box. As I say, I've gone through my big one, which is the Smecta. By the way, for kids, I showed you the powder version earlier, but you get this liquid version. Easy to go, just tear the top off and suck it down. So that's a really good one for children for medicating on the go. But a couple of things. Obviously, we deal with a lot of overland travel and driving. Sometimes in other modes of transport, boats, ships, helicopters, aeroplanes, but there's nothing worse than motion sickness. So get a really nice motion sickness tablet that's sort of a pediatric version or can be taken by children, and have that on board, because there's nothing worse than being in the vehicle for 10, 11, 12, 15 hours, feeling terrible and wanting to vomit all the time. So motion sickness tablets, an absolute go-to for children. One that we didn't touch on earlier is, you might end up with an ear infection on tour, on holiday. So either from various reasons, but also from swimming, swimmer's ear and that, general ear infection and inflammation, and that can really make or break your trip. So a nice ear drops, and they're small. Got a little a nozzle in here, so suck it up and apply it into the ear and deal with ear infections. I always like to keep Andalex with me. You end up with a bit of a throat infection or sort of a cold nasal drip becoming a throat infection. Take away that pain in the back of the throat and any inflammation that you get in there. It is antibacterial as well, so good old Andalex, definitely include in your kit. And in dealing with ENT sort of stuff, a good go-to that we always use at home and on traveling is Iliadin, nose drops. So put Iliadin in there. A good favorite also, goes with the calamine lotion, I think, as a kid, is what we referred to as monkey blood. Fun for the kids because it looks quite ominous and it's serious and it's red and it makes that injury look worse than what it is. There's a lot of drama involved. It's medically known as mercurochrome. But a little dab on a earbud or something on an injury, dries it out, keeps it clean. So mercurochrome, just don't let it spill. I think they put terrible caps on these things, but sometimes they can spill out, and then everything is stained red, and it'll stain everything. So monkey blood or mercurochrome, absolute go-to all the time. And then from my side, one of the last sort of main ones is Calpol tablets. You either get the little Calpol suppositories or the liquid form or the tablets for pain and fever. Great for kids, headaches, backaches, muscle pains, but general pain and fever. And we use Calpol a lot. So I think from a kid perspective, as well as the lotions, the allergy lotions, the calamines, the Allergex creams, or anything along those lines, they're going to be getting skin rashes, maybe to caterpillars or something along those lines, are very important. Kids are probably picking up firewood. You might end up with a scorpion sting or something like that. Putting shoes on, we're used to checking into shoes. Make it known to the children when they go put their shoes on in the morning, check what's in there, shake it out, and then put their shoes on. So running around at night, around camps barefoot, so that's what I'm saying is they've become more conducive to situations happening than adults. So just have the stuff ready to deal with kids. Look, there might be a couple of things that we've omitted or left out. This is not scripted. We just literally talking as to what I have. I've traveled a lot with my two kids from a very early age into the bush, and obviously as a profession as well with clients. I'm not a medical practitioner or a responder or anything. I've done some first aid courses, but I think there's a bit of common sense as to what you need to take out with you. Be responsible, rather have it and not need it than need it and not have it. And that's with regards to medication, spare parts, you name it. When you're out there, you're going to be, I wish I had that. So, I just thought it would be interesting to share this all with you. A little bit of our preparedness for going out on a tour, especially like what we've got. We've got a really exciting trip coming up, which we'll elaborate a little bit later about. But Martin, thank you so much for sharing some of your knowledge with me today, reaffirming some stuff with me, and donating, where did it go? I think it's that one. Donating a first aid kit as well that we're going to sit and fiddle with and add to as well, and take away from. But really appreciate it. And please, at any point, Martin, if I look at his badge here, it's Martin Millar Safety Consulting. That's what Martin does. He consults to various companies with regards to health and safety issues, as well as first aid training. And I think it's super important. It's daunting at times, but you know what, it's a big part of life. So Martin, thank you very much for coming around. Martin's a big supporter of the Safari family as well, and I really appreciate that. So thank you, and good job.